It is 8:51. Welcome back. Want to make sure you keep that forecast every 10 minutes with our weather on the ones. You can expect today to be pretty nice. 81 degrees looks to be our high temperature. There will be a mix of some sun and clouds out there and cannot get rid of a chance of isolated showers this afternoon. But overall, a pretty good day. The second in a string of good days that should last for about a week. Another update is 10 minutes away. So as if you need it, there's one more thing to be thinking about this holiday season, your health insurance. Open enrollment is underway, and signing up means there are questions that need answers. So for some help, Jason Marra, who's the president of First Family Insurance, is here with us this morning. We appreciate you coming in.
I appreciate it, Tom.
This is a tough time for so many people to enroll and look at their options. So if they're looking to sign up for health care, what's new this year? What's different about this year's process?
Well, it's really two different things this year. Okay, number one, the bad part is higher penalties. Okay, so your penalties for not having health coverage are either 2 to 3 times greater than what they were last year. Plus, let's not mention that nobody's even paid a penalty yet because no one's filed their taxes.
Right.
Yet.
Nobody knows what the first penalty
Correct.
is.
So the penalty goes from $95 per person, okay, to $325 per person, or 1% to 2% of your household income, whichever is going to be greater.
So it can add up if you don't have
Absolutely.
health insurance.
So if you have a household income of $100,000, you're going to be paying $2,000 in a penalty.
So you got to be prepared for that. So if you're looking and you know you need the insurance, what do you recommend people look for? There's so many options.
Well, I think that's really the problem is a lot of people don't know what to look for. You know, we've been seeing people hopping on there. They still don't understand, no matter how much things have been on the news and what's been talked about, they don't understand what a subsidy is. They don't understand how to get a subsidy. They don't know anything about coverages, deductibles, co-insurances. And one of the biggest problems that I think has been really forced and looked at is they keep deterring you over to go on to healthcare.gov and shop. But if you don't know what you're looking for, what you're doing, you don't know what to shop for. Okay, so what a lot of people don't know is you can contact your insurance agent. Okay, so insurance agents can be out there. They can help you through the process. It doesn't cost you anything. Just give them a call.
Get an advocate for yourself to help you go through that myriad of terms and words and everything else.
Absolutely. Plus, they'll look out for you year to year. Okay, go on healthcare.gov. You're going to be responsible for reshopping every year, knowing what's going on with your plan. If you have an insurance agent out there, they'll at least be able to call you every year, review your coverages, see if something's a better fit.
What do you think is, in a sense, a minimum? What should people make sure they're getting in terms of coverage?
As far as a minimum, any of the plans out there are fine. So if you're getting something that's going to be on exchange through either healthcare.gov or any of the marketplaces out there, they're all great plans. I mean, the essential benefits do cover you with what you need.
And, you know, because this is so growing, this signing up enrollment for healthcare, First Family's been growing. You're a lot bigger than you used to be.
Absolutely. You know, we started in 2008. Since then, we have over 1,000 agents nationwide right now. Just this year alone, we've grown by 228 agents. Over a third of them are here locally in Lee County.
Wow, not bad. That's a pretty good success story with all that. What's going to happen, do we know, with prices? What do prices look like for this year's plans?
They are going up, okay? So that's one thing. If you had insurance last year, do realize that you probably got a big rate increase, okay? And that's one of the reasons why to shop. So nice part about this year, okay, as opposed to the bad penalties, is you do have more carriers, okay? So this year, Lee County, you do have 4 different options. You have United Healthcare, you have Assurant Health, you have Blue Cross and Cigna, where last year you only had 2.
Well, that should help some. Thank you, Jason, for coming in. Hopefully
You're
people
welcome.
get some help. Seek out answers from healthcare professionals if you need it. And we do this morning. We'll be right back.